So we have Amanda Scheer, and she is a physical therapist at HSS. We also have Dr. Carlo Milani. He is a HSS physiatrist, and Marc Ross as well is a physician's assistant from HSS. They all work at the HSS Midtown location, and the focus there is on coordinating appropriate care for each patient. So welcome to tonight's webinar, Bruises, Breaks, Sprains, and Strains. Where do I start? On tonight's webinar, we're going to address how to identify the appropriate provider type for your muscle or joint pain by first speaking to the different types of musculoskeletal providers available, and then tips to manage that muscle and joint pain.
My name is Amanda Scheer. I'm a physical therapist at our HSS Midtown location. I see patients kind of who come from different providers' office, have seen different doctors and get referrals to physical therapy. But also in the state of New York, we can see patients via direct access. So for 12 visits or 30 days, depending on your insurance plan, you can come see a physical therapist without actually needing to see a physician. So as we go further into the talk, there might be instances where you have a musculoskeletal issue, and the first line of defense could actually be physical therapy. But let's hear from Dr. Molani and Marc as to what kind of providers they are. Dr. Molani, you want to start, or Marc?
Sure. My name is Marc Ross. I'm a physician assistant here at HSS. I've been here for a little over 11 years, but I've been in practice for about 19. And currently I see patients with knee, wrist, and hand injuries. It could be general, people just have general aches and pains or sports-related injuries. And then the hospital provides a virtual on-demand service that I also cover, and that's more of a general orthopedic type of triage service that we offer.
Hi, yeah, I'm Carla Molani. I'm one of the physiatrists here at HSS. I practice primarily out of the Midtown office and then on the Upper East Side next to the main hospital. For those of you, it looked like there was maybe only 11% of the people who answered had seen a physiatrist, and that may be also the only people who know what one is. So as a physiatrist, we are specialists in treating conditions that affect bones, muscles, tendons, joints, nerves. And so my primary specialty is sports and spine medicine. I did my fellowship here at the Hospital for Special Surgery. And I also have a focus on the upper extremity and electrodiagnostic medicine. Physiatrists in general, do a whole host of things, largely in the musculoskeletal realm. And then we kind of tend to focus a little bit too. Those are my my sort of focuses.
So let's say a patient, so let's say someone falls on the street, what would direct that patient to see Marc? Like, what should that person look for to say, I remember this talk from Marc Ross and what he sees, I fell on my wrist, versus trying to get in to see you, Dr. Milani?
Well, I think really, I'll let Marc sort of give his perspective too. But I think if you're injured and you fell on your wrist, and let's say there's some sort of deformity, or there's a lot of swelling, something like that. Really, I think seeing either Marc or myself would make a lot of sense. We can order imaging, we can do other tests to look for fractures and that sort of a thing. But let's say you fell on your wrist and you can use it pretty well, and it's just kind of sore and you're not quite sure what's going on. You think you might, need some treatment, maybe some physical therapy or something like that. Amanda, what do you think? Do you think that they would be able to kind of see any one of us and we could try to understand what's going on and help direct them to the right place if it wasn't one of us?
Yeah, I do. I think that, as a physical therapist, we're sort of groomed as generalists. So to kind of look at every part of the body and rule out more so than rule in. So to say, okay, are we looking at something that's broken here? Does this person need imaging? And then sort of stemming down from there, or can this be managed more conservatively? Do we try physical therapy for a couple of weeks and then seek a physician opinion, seek imaging or something a little less conservative, something more medicinal? So yeah, I think that you can't go wrong in seeing either of us, unless of course maybe something more traumatic where there's blood or there was a contact injury and you can more see a deformity. In that case, I think more physician right away is probably the way to go.
What about you, Mark? What do you think of that scenario?
Yeah, no, I definitely agree. Anytime you see a major deformity or things just don't look right, or if pain is sort of out of proportion to the type of injury that you sustained, then something more urgently needs to be done. So even an urgent care or emergency department. But if you, like you expressed, if you think it's just a sprain, you sort of will just have a set of eyes on it, then yeah, any one of us can sort of step in and order the proper diagnostic imaging and sort of refer and map out the steps in order to get them the appropriate care that they need.
And let's say, so the three of us are all in Midtown. So if a patient, goes downstairs to see Dr. Milani or Mark, and you send them up to see me, we do communicate often, usually whether that be via email, via phone, but because we're in the same building, we do see each other as well. How important do you find that it is, if you send your patient to physical therapy, or if Mark, you send a patient to Dr. Milani, how much communication do you find is important for plan of care?
I think open channels are the best, the best rule of thumb. You want to just relay, if you have any questions. I have an open door policy, so I think just communication is key in getting the patient the right treatment.
Yeah, I agree. I think that especially our model we have here at HSS, and especially in Midtown, in a lot of our locations, we're fairly co-located, meaning for example, people from different disciplines, physical therapists, PAs, physicians, surgeons, we're all very accessible to each other. We have open lines of communication sort of more broadly, and especially when we're all physically in the same building, we can kind of run up and down, talk to each other about patients. That's a pretty valuable thing, especially if somebody comes in and we realize, somebody realizes, okay, well, they actually do need some imaging. You can come up and talk to me. Happy to help and see somebody, or order imaging if needed, or sort of make sure that they get to the place they need to go.
Also, like just for example, today, while I was covering that service I mentioned earlier, the virtual on demand, I saw one of the spine surgeon's patients who was 1 year post-op, and he had an urgent question. So he logged on to the virtual on demand service, and after that, when I was done with him and made sure that he was stable and ordered a new MRI, I just quickly sent his spine surgeon an email just to let them know what's up. So again, I think it's important that all the communication lines stay open, and that if I'm treating a mutual patient of one of the surgeons or physiatrists or even physical therapists, I just let them know that, hey, I saw your patient today, this is what happened, and just to give them a heads up.
Yeah, and from the PT side of things, we usually try to communicate sometimes for advice. I've tried X, Y, and Z with a patient, whether or not it's been successful, and if it's not, suggestions and input from medical staff, which is super helpful, and it's very encouraged here, so that it's a more it's a team effort in taking care of everyone, which is nice, and even great, more beneficial that we have everyone physically here in Midtown. I'm going towards the question bank to see what our viewers are wondering. So a question is coming in about swelling, about a year post-injury, and if that swelling should be expected to ever go away, or will it be permanent? Is this this patient is wondering, or this person is wondering. What do you think?
Well, in my opinion, swelling, and if it's associated with pain, your body is usually telling you something. But it also depends on the type of injury. Swelling can take a long time to dissipate, in my experience. But again, it also depends on what type of injury it is, and if this is just a recurrence, or it could be an indication of a new injury. So it could take some time for swelling to go down.
Yeah, I think I can see that question there. And I would say, it really depends on the type of injury and especially the location. For example, if it's in the lower limbs, then swelling could be related to an injury that occurred a year ago, or it could be related to something completely different. Other organ systems, the heart, the cardiovascular system, the renal system. So it's important to, if you're having those types of issues, just to make sure that you're getting it checked out. You're seeing somebody who can kind of help understand what's at the bottom of it all. And so that's a good question, but I think it really also depends on, like Mark was saying, on the type of injury and what it is.
A lot of these injuries are questions will come in, they're so individual, and we see that every day in practice, that an arm is not the same on every person. An ankle sprain isn't the same on every person. More importantly, it's just, we're trying to give information as to where you should go seek your care, rather than Google or WebMD, because those can usually steer you in the wrong or a frightening direction. So Mark, if a patient comes into you, what services does physician assistant offer versus physiatry? If they're on a website trying to schedule, what's the what would be a difference there? Patients ask me that often.
So, I am trained to, well, first of all, our schooling is modeled after physicians and medical school, basically. So we are trained to get extensive histories, physical examinations, come up with a diagnosis and treatment plan, order diagnostic imaging, x-rays, MRIs, and interpret those. And I'm also trained in giving injections to the knee, both corticosteroid injections and the hyaluronic or gel injections. I've given trigger finger injections, injections for certain types of wrist pain that are associated with, some tendonitis. So we're similar, but the training that goes along with physiatry is a lot more extensive.
A couple of questions are coming in: osteoporosis, osteopenia, in terms of someone's looking at a particular type of physical therapy. And no, physical therapy, like I said, we're more generalists, so we do really treat everything, even though we all have sort of our body parts that we might focus more on continuing education. But oftentimes for osteoporosis, weight-bearing activities are most important, and any physical therapist can guide you through that. And a similar question, down the thread was, to whom should a person with some osteopenia or osteoporosis see? So Dr. Milani, what would you offer for someone who came in with their own DEXA results for osteopenia?
Yeah, that's a good question. So I don't specialize in treating osteopenia or osteoporosis. I generally give my patients, some advice regarding nutrition support, that sort of thing, to support bone health. But I'm not, I don't specialize in treating metabolic bone issues. I do refer to my some rheumatology colleagues, some of our orthopedic surgeon colleagues, and some of our endocrinologists here at HSS frequently. I work pretty closely with a lot of them because I see osteopenia and osteoporosis all the time. What I do sort of work with people on is developing exercise prescription plans, and talk about activities and like hobbies or sports or those sorts of things that are people want to do who have osteoporosis but want to be safe doing it. So we talk a lot about how to do activities safely, how to do exercise, take exercise classes, participate in those sorts of things safely, so that you're not putting yourself at more risk for fractures, either fractures of the spine or fractures of the extremity, that sort of thing. Because that's really what we get most concerned about when somebody has osteoporosis. Osteopenia, we're trying to really prevent that. So we talk about, resistance training and options to do that safely, trying to help maintain bone quality, that sort of stuff. So that's sort of the angle that I see patients from most often. But then when it comes time to understand how to treat with medications, that sort of thing, then I definitely rely on the expertise of our colleagues.
Yeah, I agree. And the hospital actually, you had mentioned several of the services. They have a specific metabolic bone service that they're fantastic. And like Dr. Milani mentioned, you want to focus on safely increasing their weight-bearing exercises to help build up and strengthen the bone.
And going more towards the direction of prevention, what would be, a piece of advice or two that you would give people on preventing bone and joint pain, preventing them from needing a visit to see any one of us? What are your go-to pieces of advice?
For me, it's all about proper body mechanics. If something hurts, like the old saying, don't do it. So, your body's telling you that something's wrong. So if someone is, I've always heard that it's okay to stretch through pain, but it's never okay to sort of exercise through pain. Because again, the body's telling you something, and you want to sort of either do it under the guise of a personal trainer or just a couple of sessions, or if you're at the point where the exercise is still bothering you, and maybe a few sessions with a physical therapist would be beneficial, and just so that they can monitor you and make sure you're doing the exercises correctly, and hopefully avoid any further injury.
Yeah, I'll emphasize some of that, and I'm really interested to hear what you have to say on this, Amanda, because I know you'll have a lot of good things to say. So I think, if you're talking just what can you do for joint pain, it's I won't take up too much time, but it's sort of a broad topic, right? So it depends on which joint, whether it's weight bearing or not, depends on sort of your baseline mobility and that sort of stuff. But generally, I think like Mark was saying, if something hurts, then maybe there's a reason. So maybe it's because of how you're doing what you're doing, not necessarily that you can't do the activity, but maybe it's how you're doing it. And there's a way to safely do it or more comfortably do it that we can work on. Sometimes it's related to features more of the particular joint itself. So joints generally like to be mobile, and they like to have support. And so if you can make sure that the muscles around the joint are flexible, the joint itself is mobile, and then you're strong enough to support joint stability, those are really the keys to joint health. I mean, that's sort of a gross overgeneralization, but that's sort of some sort of something you can sort of maybe hang your hat on, some generalities. Amanda, what do you think? I know you're the expert here too. So.
Yeah, and I mean, again, these things are very individual, but pain is our body's way of telling us something and giving us information. So, we all want to not feel pain, but sometimes that's our body's way of saying, just step back and let's look at what you're doing, and asking questions is always important. Is it the form? Is it the weight that you're lifting? Is it just general soreness because you have been exercising and we're quantifying pain differently? So I don't think pain is something we should be afraid of. It's just more a matter of, if you're at the gym and actively something doesn't feel good, you should stop and figure out if it's that exercise and how you can change it. If it's more the day after, then it's sort of a check-in with was the prior exercise, was it too much? Maybe you just need more rest. So there can be something for kind of waiting a little bit before taking emergent action versus your pain. But then, yes, there's a lot of professionals out there who are very trained in answering these questions. So if you are, don't suffer and ask, whether it be that exercise physiologist at the gym, whether it be your physical therapist, whether it be an MD, because I think that's where we tend to make mistakes, is pushing through it for too long, and then a small problem can become a big problem.
Yeah, and you know, right now we're kind of talking about, you know, achy, sore joints, that sort of a thing, but there's sort of a whole other category of, you know, inflamed or swollen joints, which could be, you know, more of an inflammation issue or an inflammatory issue, or sometimes even an infectious issue. So, you know, again, the general question about joint pain, you know, there's sort of broad buckets of ways to think about it, but either way, if it's been going on for a while, you want to have somebody check it out because there may be some way to help.
Especially if it's not responding to what you would normally say, oh, you know, I rested or I iced it or tried an anti-inflammatory. If it's okay for you to take one safely, then yeah, it's probably best to look into it sooner with a professional like one of us, and then just hoping it would go away.
And in terms of, you know, let's say someone trips up the stairs or they twist their ankle on the street, what time frame would you say that person should seek out medical care? Like, you know, usually the convention would be rest, ice, compression, elevation. Are we still saying that? Should we have, you know, how long do we have people do it before seeking opinion?
I think people are pretty in tune with their bodies, and so they sort of get familiar with either these sprains and strains. If it's a new type of injury and you're just not sure, then, you know, it's pretty easy to set up an appointment. You know, listen to your body, listen to the cues it's giving you. Like you said, pain is the body's way of telling you that something's not right. If there's a lot of swelling, if you're having trouble bearing weight, you know, these are more serious indications that something is wrong. If it's just, oh, you know, it aches a little bit, you know, it's sort of hard to put a time frame on how much time is sufficient to where you say, okay, I think I need more intervention. But I think we're pretty in tune with our bodies. So just listen, and listen to those pain receptors. Look for the swelling. You know, just.
Yeah, I agree with Mark. You know, I think that some of the bigger things to pay attention to are if you have a trauma, that could be rolling an ankle, or that could be, you know, something else. But if you have a trauma, and, you know, the things you really want to watch out for are swelling. So if there's a lot of swelling, if you have trouble putting weight on it, whether it's, you know, a hand, a foot, whatever, or if you notice any deformity, those are kind of some three big things that you would want to watch out for. And if you have, you know, kind of one or more, you might want to think about seeing somebody.
There's that goes along with the question I'm noticing. How would you know if you broke something or it's just a sprain? You wouldn't. That's why you have, you know, healthcare professionals. So I always think err on the side of caution. And if you're very worried, it never hurts to make an appointment and have that provider say, we imaged it and it's fine. And then give some advice for how to feel better rather than wait. Would you agree?
Yeah, I agree. It's better to side on the err on the side of caution. And you know, I've actually seen patients come in 2 or 3 weeks after an injury, and they're like, no, it can't be, my ankle can't be broken, my foot can't be broken, I'm walking on it. And lo and behold, you get an x-ray, and sure enough, there's a small little fracture or a little chip in the bone. And it does need some type of protection, because you could potentially take something that's, you know, a fracture or a sprain that doesn't require much intervention other than conservative, either in one of those cam walkers, one of those little moon boot, space boot looking type of things, or, you know, versus turning into something that's potentially surgical to be repaired. So it's better to err on the side of caution.
Yeah, I totally agree with Mark. You know, well, that's another one of those things to pay attention to, is if, you know, the pain is pretty significant from the start and it doesn't get any better. You know, most pain will if you have a trauma like that, you have a fall, something, most pain is going to start to change. And, you know, it's going to start to get better as the body heals over 7 days, 14 days. You're going to notice some difference in the right direction. But if you don't notice any difference, or it's just really not, you know, it's minimal, then that's something to be concerned about and see somebody for.
Usually tell people, like, if you're limping or you have a loss of function, like these are things that, you know, you shouldn't necessarily have to suffer through. And that's usually when it's time to ask a professional.
Those are great points. Yeah.
All right. Anything else you would give in terms of, you know, breaking orthopedic suggestions for our audience? I don't see any more questions coming through, so words of wisdom.
You mean in terms of
In terms of like musculoskeletal health, even though, you know, it is great to have full patient loads, we want to prevent people from having to come see us.
Yeah, I would say, you know, it's been interesting over the pandemic. I don't know, I'm interested to hear what you guys have seen too. But I know, especially at the beginning, I don't know where we are right now, whether it's the middle, it's the end, you know, but in the beginning, I remember seeing, you know, people who had disrupted routines. And so they were having injuries for one reason or another. Either they'd been very active and now they couldn't sort of continue the routine that sustained them. Maybe they had arthritis in, you know, multiple joints, but they were doing great. They were skiing, they were doing all sorts of things because they lived active lifestyles. And then all that came to a grinding halt with the pandemic. They couldn't go out in public places anymore. They couldn't be around other people who were doing active things either. And so it took the gym away, it took a lot of things away. And so then they started, you know, all the aches and pains started sort of rising to the surface, whereas they had been managing them before. And then at the same time, I had seen people say, okay, well, I'm going to really take advantage of this time. And I'm going to start, you know, I'm going to run 5 miles a day. And I only used to walk, you know, a block a day. And so, you know, they develop other types of injuries. And so I think moderation is a good thing. You know, if you're looking to get more active, then taking your time as you do it and making sure that you're increasing your activity and what we like to talk about load. So orthopedic load or workload to the body. You're sort of building up that load gradually. Sometimes we talk about increasing the distance or time, let's say, for example, with a runner by 10% per week, that sort of thing. But that you're doing it all in sort of a moderate way so that your body can tolerate it. And if you've been active and that's been, you know, keeping you sane and keeping you otherwise healthy, then really, you know, if you need ideas to help, you know, sort of troubleshoot how to stay active with your current orthopedic conditions or whatever it may be, you know, that's when we're also here to help. What do you guys think? Have you guys seen any of that sort of thing? I think I've even referred some patients to you for those types of injuries.
Yeah, I think work from home has made has really changed things, changed musculoskeletal pain. So people really have much less reason to get up and move every day, and they go right into the same couch to laptop for hours on end, and then, you know, things hurt and then seek out care for that. So I've definitely had a lot of, you know, just that shock of not having to change your location too often, and then really wondering why and what's the difference, and you know, seek out professional help to problem solve how you can change that. And then, you know, those in the other camp of just needing to get out and move every day and kind of forgetting that rest is often best. And that we, you know, sometimes our bodies need a day with nothing. So there's, you know, there's too much and there's possibly too little. And that's where that moderation that you just mentioned really comes into key. So movement is healthy, but we also have to remember that sometimes we need a day off.
Yeah, you know, sort of on our topic of bruises, breaks, sprains, and strains, you know, you mentioned the ergonomics. You know, what have you seen over the course of the pandemic, the last few years, in terms of ergonomic issues for patients? Because I know that's been I think I've seen a lot of it. And I know, you know, we do telemedicine evaluations, and as a physical therapist and as a PA, Mark, you know, what do you think, is there any value in being able to kind of see people in their home environment? Or, you know, you can kind of, people are working from home now, or even sometimes you do a medical visit from a patient's office setting. And so if they're having ergonomic issues, is there any value into, doing those telemedicine visits or telehealth visits? What do you guys think?
I think it's incredibly important. Like Amanda said, people sitting from couch to laptop or sitting at a desk typing and using your mouse, it develops, they have the potential of developing a lot of strain, muscle strain, and having that workstation or seeing that workstation or that their environment is extremely beneficial in terms of like identifying what could be causing those issues. So I think it's really important.
Yeah, and I definitely had times where, maybe not the ergonomic assessment so much, because if the screen was, they're already talking to you via the screen, it's hard to kind of see what it looks like, bird's eye view sort of, but more so, what does the landscape look like? How can they get up and use their home to stretch and move around in the middle of a, what used to maybe be an 8-hour workday? When you add commuting and a lunch break to something that's, 12 hours without a stop, you can say, you have that doorway behind you. So if you get up and this is how you stretch as you're in and out of your own, your own new work setting. And I've found that that's helpful, that you can really get creative in small spaces. And seeing that via telemedicine has been helpful.
Yeah, I know one of the things I really liked is even, there have been a few times where I've helped somebody with an ergonomic assessment, that sort of thing, and they'll set up, the device they're using for the visit away from actually their computer or something else in their workstation, so we can kind of look at things and kind of adjust on site that way. And then other times, we'll go through some of the exercises they do for their physical therapy program, and I'll watch them, and I'll watch their technique and the way they're doing things, and we'll talk it through, and I'll say, I know that's not how Amanda taught you to do it, and I know when you're doing it with her in the office, it's perfect. But we all get into our home environments and things change. Not only is it just the equipment issues, but then kind of like you said, troubleshooting. Where are you going to hook up that resistance band? Where are you going to do these things? And how are you going to navigate, like, the dog being curious and jumping all over you, or the kids wanting to do the exercise with you and that sort of thing. And so we can help troubleshoot that way. So yeah, I think we've been able to navigate some of these things and help people out in new and kind of exciting ways. So I think all of us are experiencing that. So thanks for indulging me. That just kind of popped into my head, and I was curious to know what you guys thought.
Yeah, and telemedicine has become a great resource just to problem solve. If you have a question, but it's not something that you can physically get to the office for, and might not need a ton of following continuing care, but just need a little bit of adjustment in your own setting. That's where, ideally we'll never lose that now that COVID has made that part of our day, the televisits. And one last question here in the bank. Any advice for older seniors with an old ACL injury where the doctor does not see surgery as an option? So if you had this patient come to you.
Well, I think first, a hands-on evaluation would be helpful. Just physical therapy. You want to strengthen the supporting structures. You have the main stabilizer, the ACL that stops the knee from sliding forward. But if it's an old injury and now it's led to some advanced arthritis, you might not want to repair the ACL. Maybe a brace or some anti-inflammatories. But if there's a lot of arthritis in there, maybe a knee replacement might be something that you would consider or want to look into, or at least have that talk with one of the joint surgeons. But again, there's so many routes that we could go. But I think an in-office evaluation, new set of X-rays to see what the joint spaces look like, and then come up with a game plan based on what your symptoms are.
Yep, I totally agree with Mark. And if there's a lot of arthritis and you need to see the surgeon, the joint replacement surgeon, then that's the place you need to go. Otherwise, you're going to see Amanda for a while. So, Amanda, what do you?
Yeah, I think that's something that the three of us agree on, and that we're all in that same conservative management practice here for orthopedic orthopedic issues that, physical therapy never hurts anyone. So it's always a good idea to try to strengthen, try to use movement. We like to keep surgery as a last option. So in terms of your first line of defense, once Dr. Milani and Marc feel that, exercise can be helpful, then yes, come hang out with me for 6 to 8 weeks. And then we see what happens.
And we have a couple other tools in our belt, like I mentioned earlier. Maybe you're a candidate for a cortisone injection, or maybe one of these gel or hyaluronic acid injections. So there's really a multitude of things that go into consideration. It's multifactorial. How we determine your roadmap to better health.
If you need to, bracing's an option, that sort of thing. So, we can put together a comprehensive treatment plan for you, like Marc's saying. And there are lots of options and places we can take this. So that's why we work as a team.
Definitely. All right. So I think if no one else has questions, I don't see the bank going, or Dr. Milani or Marc, you have anything to add? Otherwise, I think that's all the time we have for today. Yes. All right. Thank you guys for tuning in. If you have any questions, if you want to learn more about HSS, you can email pped@hss.edu, or you can visit our website, hss.edu. And our YouTube channel has a ton of wellness information. This video will also be posted, so you can go back and reference it as needed. Thank you for coming.